Peace be to you all. Happy Saturday, February 4th, I think, by the Gregorian calendar. So, it is really cold here in Washington, D.C. 10 degrees. So, I'm here to talk to you guys about some goal-oriented stuff. And I thought about this because I was giving some... Morning.
Good morning.
I was giving a young man some advice, and he's making his way through college and young adulthood, and he's an English major. So I was asking him, why do you major in English? Yeah, the usual things you ask people who major in liberal arts. He said, why'd you choose that major? What are you going to do with it? He's like, I really don't know. And I say this as an erstwhile English major, some 35 years ago, because I was a frustrated, mediocre pre-med student. But I would get straight A's in English literature and expository writing and all this other liberal artsy stuff. I was quite good at it. So my professors told me. But I couldn't see how I could make a living with it. And I talked to Amiri Baraka. He's a poet who used to teach at Stony Brook University. And then there's, I think, Nikki Giovanni, who's another African-American poet. I think she had lectured there. But, I had access to some people who had done really well in their lives, as poets and writers. But that didn't mean that I would do well. So I eventually became a PA many years later. If you've been following me, you know my story. But my conversation with this young man made me think about, what, doing things in life that you really want to do. And it's kind of a recurring thing because a lot of people will do things because there's good money in it, quote unquote. There's good money in healthcare. My mom is a retired nurse, and she always had money. Like, if we needed extra money, she'd go work an extra shift, or go do some private duty nursing. So it was. I saw the stability, the financial stability in healthcare, and I certainly experienced that starting as a nursing assistant many years ago, back in 1990. But I can tell you, it's not without its foibles. You can get fired. That's devastating. You can get investigated. That's equally devastating. Lose privileges. Patients aren't always appreciative of your efforts. If you're in healthcare, we work in a very litigious field where, there's always threat of lawsuits, malpractice, negligence, and this kind of thing. Involuntary manslaughter. Best case, you might lose your license, and worst case, you might go to jail. And we've already seen that happen with some doctors and nurses. So it might not be the safest field for people to go into if while you're looking for job security, but not necessarily safety. And the same can be said for other fields, law enforcement and so forth. But I guess my point is, find out what you really want to do, and it's a real conversation that you need to have with yourself. I recently lost the job in ER, and I thought that I would be really good at this. They needed somebody to fill a certain position, and I thought I was well qualified. They thought I was well qualified, but the skill set that was required for this particular position, I just didn't have it. And I sought some help. Sorry, post-nasal drip there. It's cold. I saw advice from this guy, John Belinsky. He's absolutely amazing educator for emergency medicine. And he said, look, do you really want to be good at this? And I didn't answer him. The question made me suddenly just be quiet and kind of reevaluate myself and my life goals. And I'm like, wow. The way he asked the question was like, it was really it's a simple question, but it's a very profound question. And I said, well, okay, you know what? I need to get back on you on that. Because at this point, I don't know. And I parted the job on amicable terms. Everybody liked me. And I liked the doctors and the PAs. One doctor asked me, he said, look, at this point in your life, in your career, you want to really ask yourself, is this something that you want to change into? Because it's really, really challenging, man. You can't go in there and kind of sort of BS your way through patients and patient management. You got to know what you're doing, because you can cause a lot of damage to patients. And thank God I lost the job before I did any damage. But I thought, well, at this point in my career, what is she talking about? I said, I had to stop and say, Omar, you're an older guy now. When I was a kid, I always wanted to be a man. Well, you're that man. You're in your mid-50s now. You're looking at, I'm closer to retirement age than I have years, I have years behind me. So retirement, I'll be 55 this year. My God. Retirement's around 67, I think. So I've been a PA for 21 years. So looking at, well, you only have like 12 years left before, you don't have to retire, but that's retirement age for most people. And what do you want to do with those next 12 years? That's an important question that I got to ask myself. What do you really want to be good at? I think I've been a good hospitalist and a good healthcare provider in the various capacities in which I've worked. Mostly outpatient with working with the indigent, and that's something about which I'm really passionate. People who don't necessarily have advocates, but need a lot of health care. These little outpatient clinics where I've worked over the years, it's kept them out of the emergency rooms, because that's usually their point of primary care. They go to the ER. But if you've got these outpatient clinics, that's where they can get a lot of preventative services. Anyway, I would ask you guys to ask yourselves, what do you really want to be good at? If I would not suggest medicine to anybody who's not really interested in it, who really just wants to get a paycheck, a steady paycheck. You'll make good money, but you're just going to be a warm body. We all know a lot of warm bodies. It's people who you just need somebody to fill a shift or something. Maybe pass out meds without thinking. Those aren't the best people with whom to work. They bring a lot of negative energy to the workplace. Don't be that guy or gal. And in conclusion, just ask yourself what you want to do. There's a movie I saw in this great painter named Jackson Pollock, and in the movie, the lady that was playing his wife said, they were really struggling. She said, listen, we're artists, Jackson. We don't get by, we struggle. And if you're doing something about which you're passionate, you don't mind the struggle. You don't mind, going without food, possibly without housing, because it's something about which you're really passionate. But find out what that is for you. It's different for everybody. That's it for now. I wish you guys the best of success in your positive endeavors. Reach out to me if you want to be a PA. I really enjoyed it in the capacity in which I've worked. Been doing it for over 20 years. It might be for you. All right, take care. Peace.